Welcome to the 6th episode of our discussion of polycystic ovarian syndrome. In this episode, I'm going to discuss lean or athletic polycystic ovarian syndrome. This type of PCOS is most often missed by family doctors and general doctors because they expect women with PCOS to be overweight. These women do in fact have PCOS, and they comprise perhaps 10 to 15% of women with this diagnosis. They tend to have moderate menstrual irregularity. They can have a period every 4 to 6 weeks typically. They tend to be rather lean and sometimes even underweight with good muscle definition. These women generally don't have hair growth issues, but they can have acne, and sometimes they can have severe, very bothersome, distressing acne. It can be on the shoulders and the back as well. They can be fine-boned just due to the general nature of their condition. Now, women with lean PCOS frequently have a straight waist to hip profile. Most women have a waist that's smaller than their hips, about 0.7 or 0.8 ratio. Women with lean PCO can be straight up and down. Their waist can be exactly the same size as their hips. Once you know to look for that, it becomes fairly obvious. Now, these women just love to run. Not every one of them, but many, many do. Now, you need to realize they're not lean because they run because they're lean. It is their genetics to do that, and they get great pleasure in that frequently. Now, a woman can overrun. She can have low body fat and high physical activity, which is senses a stressor in the area of the brain called the hypothalamus. And in fact, hypothalamic issues can somewhat mask and somewhat balance the polycystic tendencies. It's kind of interesting. It's important to realize that these women are not at increased risk for diabetes, and they generally don't have any other metabolic issues that you would equate with more severe polycystic ovarian syndrome or obesity. To treat these women, they clearly do not need to lose weight, but generally they benefit from a small increase in body fat and a decrease in cardio type exercises. I suggest these women lift more weights and stretch and do less cardio, and in the process of cutting carbohydrates moderately and increasing body fat a little bit, generally ovulation improves. Now, some of these women can be very tricky to ovulate, and to treat them for infertility can sometimes be very tricky. Just like a type 1 diabetic, it can be very brittle. They can be on a knife edge, and if you give too much medicine to ovulate, these women can ovulate too many eggs, and that has its own problems. Generally, these women with the changes I mentioned will ovulate with simple, safe, cheap pills, and fertility can be overcome. But there certainly is a small subgroup of them who can be very difficult to ovulate, and sometimes we need to go on to advanced technology just to ovulate safely and effectively. So, lean PCOS, frequently missed. People don't know to look for it, but it's out there. It's a real thing, and it's very easily treated once you understand the genetics and the condition. I hope you found that interesting.